Yeah, so sometimes it's really hard to frame traumatic experiences into words, but art offers you that little distance. So, what a lot of people say when they come to art therapy is, I cannot draw. That's the first thing people tell me. I cannot draw or I'm not good at art. And I think the fear is around judgment because most of the time with a lot of these people that tell me that when we are talking about so within the outpatients we do some processing after the activity so people talk about the meanings behind their work and when people present their work a lot of times it comes with a disclaimer. Don't look at it. It looks horrible. I know it looks like it's done by a 2-year old. It's terrible. Like people do those disclaimers before they present their work. So I think for me, it feels like the biggest fear is that people will judge you or say you're not good enough or it's not good enough. So that's really.
So can art therapy actually make things worse? Are there some people who shouldn't be doing art therapy?
I haven't encountered it. I have not encountered it. Um, But what I would say is that I have had clients who are more inclined towards movement or more inclined towards music, and sometimes that feels like a more natural expression for them. So I think it really depends on the client and what they want. I haven't experienced it not being good for anybody. We were all artists as kids.
So when you in your private practice, I know in inpatient that they have groups, but do you have in your private practice you have groups, classes or anything like that for people, or is it all one on?
All one-on-one, all individual at the moment.
So at the moment, so is that something you're thinking about as you move forward? I know you only have so much time to go around right now, especially while you're working on your PhD.
Yeah, so I haven't really been focusing on my private practice right now, as I said, because of the PhD, but hopefully once I complete my PhD, I'll be able to focus more on my private practice and building that back up. But no, I at the moment no groups and I take very
Okay.
limited clients.
So, you've done research on art therapy with veterans dealing with PTSD and traumatic brain injury. What does this approach offer that traditional talk therapy can't?
Mm. Yeah, so sometimes it's really hard to frame traumatic experiences into words. And also how do you say, the intensity of the feeling is difficult to articulate into words, especially with people who suffer from PTSD and definitely a lot of veterans who have witnessed a lot of trauma. I think that art offers a little distance from it. Sometimes I don't know if you've ever noticed this, like when you're talking about something that is traumatic, you almost re-experience it right away because you are
Mhm.
talking about it. But art offers you that little distance, you know. Sometimes people, when they're not yet ready to do that processing, they may not talk about it, but they might be creating an image, right? And that image is the language. So I think for me, the benefits are really like sometimes pre-verbal trauma, like sometimes people who have experienced early childhood trauma is super good for them because they just don't have the words for it, right? And then when words are difficult or when actually accessing that trauma through words is difficult, it provides a good distance for you to be able to process that.